Hi, Dr. Joe Alaimo here. Today I want to talk to you a little bit about some fat-storing hormones. See, a lot of times patients that can't lose weight, especially in my experience, anything from the age of 35 to 65, there's always a hormonal imbalance making it difficult to lose weight or even gain weight if that's what you're trying to do. So what we're going to look at today is the three main fat-storing hormones. First one is insulin. Now, insulin's job is to escort glucose into the cell. So when your blood sugar rises, your pancreas will release insulin. Insulin will take that glucose to the cell. If you have too many carbs and too high of a blood sugar, your body's going to release too much insulin. If it releases too much insulin and all that insulin is trying to get the glucose into the cell, we become resistant to insulin, which is another name for prediabetes. And then after that will follow diabetes. So real important to get that insulin under control. And the way you do that is by cutting down some of those carbs. Number two is that we look at cortisol. Cortisol is your stress hormone. It's released anytime the body's under any type of stress. Most people think of stress as like emotional stress, like death of a loved one or something like that. However, the body perceives all three types of stresses exactly the same and it releases cortisol. Those are physical stresses, like running from a dog, fight or flight. Chemical stresses, which are the things that we take in, the chemicals, the pollutants, and different things that foods that we eat. Those are all chemical stresses to the body. Skipping a meal is a stress to the body. And then you also have emotional stress. So we have emotional, chemical, and physical stressors. The thing is that the body will release cortisol, which will give you belly fat, brain fog, in any types of these stressors. We were made to do short-term stressors and not long-term stress. So we need to get the stress under control, and we have very effective ways of doing that. The third one is estrogen. Obviously, you see this more in women, usually after the birth of a child or menopause. And again, it will give you that unwanted belly fat, fat around the legs and your butt area. And estrogen typically comes from elevated estrogen. We get xenoestrogens from the environment, and we're taking that in. And also low progesterone, because progesterone and estrogen need to be balanced. So again, we have insulin, cortisol, estrogen. I remember that by saying ICE, I-C-E. And those are your three main fat-storing hormones. If you don't get this under control, you'll never lose weight. Thanks. Have a great day.